morning. It's day 7 and this baby had a new trach, so we need to change it out today. So as you can see, I've gotten all the supplies ready. I got my bag and my mask, and I have my suction. I've already lubed up some of this stuff, so I'm all ready to go. I have a same size trach, I have a size smaller trach, I have an extra spare endo tube just in case. I have a bougie, a pediatric bougie, suction catheter. I have my trach cleaning kit. I have an extra tube holder, or a tracheostomy tube holder, whatever you call them. Trach ties, that's what they are. I have my sterile gloves and my lube, and we're ready to go. So everybody's busy out there. I'm just going to do this myself. It's fine. It's totally fine. I've done it before, so I'm not really concerned much about it. Oh, you have an HME. Well, let's just take that off. Oh, shoot, I forgot my gloves. Put my gloves on here. It's fine. It's mostly sterile. Alright, I'm going to take this off, and probably don't need that anymore. Change this out here. Oh, shoot. Just a second. Oh, hey. What's up? Yeah, it was a good time, wasn't it? We had a lot of fun. Yep. It's totally great. Thanks for inviting us again. All right, I'll talk to you later. I'm changing a trach right now. Bye. Oh, I don't need that either. Oh, shoot. Your trach came out while I was on the phone. I got it. It's fine. It's fine. Just clean it up real quick over here. It won't go in. Oh, there it is. It's fine. It's the same one. I'll clean it up later. I'll just do this again. Maybe I better go get somebody to help me.
Jason, it's time to change this baby's trach. It's been over 7 days. We've got to change this trach out. So you're going to help me do this, okay? So I'm going to make sure that you're going to be the holder and the helper, and I'm going to be the one to put the new trach in, okay? So let's double check. Do we have all of our safety equipment? Bamboo bag, mask, suction, hooked up, running, functional. Over here we have our trach that we're going to use, a smaller size trach in case we can't get that in. I have an endo tube in case we can't get that in, a bougie if we need it, a suction catheter if we need it. I got my trach tube holders. If I need a syringe, I've got that with some sterile water to fill it, lubricating jelly, and I got my suction kit I'm going to use my sterile suction. So we've pre-oxygenated the patient. We're ready to go. So I'm going to put my sterile gloves on, Jason, and if you want to get ready, take off the HME, pull out the trach. I've got the other trach with my obturator ready. I'm going to put this one in. Got the trach in. I'm going to pull the obturator out, and now we can secure it.
Thank you.
So now we're going to talk about when we have a challenging trach patient and some things that you can do if you're having a hard time getting the trach back in.
I'm going to take this out for you. Go ahead.
I'm going to insert the new trach tube with the obturator. I'm having a really hard time getting it in, even with the rigidity of it.
Let me get this suction catheter.
Okay.
Take out that.
Take that back out.
Put that in. Alright, I fed it in. I'm going to take out that end.
Okay.
Just slide that trach over. This is your one. There you go. Let me know when you're down there.
Okay.
Got it. I got this.
In we go.
Okay. All right, so this baby, we're going to demonstrate that we're not able to get the second trach back in even with the obturator or the suction catheter. So I'm going to use a bougie catheter and insert into the airway.
Where are those kept, Christy?
Those are kept in the emergency department and or the pediatric intensive care unit storeroom.
Yes, they're by the gyroscope plates.
So you just
By the crash cart.
insert the bougie into the airway, keep it straight up, and then go ahead and insert the trach over the bougie, get it into the airway, pull it out, and then go ahead and inflate for me, Jason, with that sterile normal saline, and then we'll bag through the trach. I couldn't get this trach in with that method. I'm going to pull out either the same size endotube as the trach or one smaller, and I'm just going to lube it up and insert it right into the trachea, inflate it with a cuff, or with a syringe, inflate the cuff with a syringe, and bag through the endotracheal tube.
And that cuff is air.
That cuff is air, yep. And we got chest rise, and our saturations are good. And this is, you can cut this trachea tube down, bending all over until you can get your tracheostomy reestablished with the physician.
This patient has a 3.0 shyly uncuffed and was not on the ventilator. Now the patient needs to go on the ventilator, so we need to switch it to a cuff tube. And the cuff tube needs to have sterile water, not air. So we will demonstrate that process. So I've got a 3.0 Blavona cuffed. So we will take that
Ready?
trach out.
Okay, trach out.
New trach is in. Obturator out. Got sterile water in here. Inflate the cuff.